Hey friends, it's Quenby, the Grateful Therapist here on YouTube. I've been a therapist here in the state of California. I'm a licensed marriage and family therapist for over a decade, and this channel, The Grateful Therapist, is all about mental health and personal growth. Today's video is about counseling teen clients specifically around anxiety. So I'm going to talk a little bit about how I talk to teenagers about anxiety and how I help to educate them and give them some coping skills. So this video will be perfect for you if you're someone who cares about a teenager, or maybe you're worried about a teenager in your life that might be struggling with anxiety. Or if, like me, you're a mental health professional and you think you might be working with teens as a counselor or in some type of therapeutic setting. So I don't know if you've noticed this as well, friends, but I feel like I've noticed a real increase in anxiety in some of my teen clients. It's definitely one of the most common complaints, and what's bringing people into my private practice the most often is anxiety. So the first thing I really want to do is normalize anxiety for the teenager and their family. And anxiety response to certain things are normal. If everybody deals with anxiety at some point in their lives, maybe you are applying for a new job and you really want to get it and it just gives you butterflies in your stomach to think about going to an interview. Or maybe you have an exam or something like that coming up. So everybody knows kind of what that feels like for them. So it's a normal, healthy response. Unless sometimes it gets exaggerated, it gets too frequent or too intense. That's what we're really looking for when we're going to make some type of clinical diagnosis about anxiety. We're looking at the intensity, the symptoms, and the frequency. If you are worried about a teenager, you definitely want to make sure to bring them into your own mental health professional or their doctor if you're worried about maybe making a diagnosis of some type of anxiety, so that you can definitely get the help that you need. So I just want to say there are so many ways that clinicians can treat anxiety, and there are so many theories about where it comes from and what the best strategies are for teaching about it and treating it. I'm just going to share one way, something that has worked for me in my practice with clients over the years. So I hope it's helpful for you. One of the first things I do is normalize anxiety and talk about how everybody gets anxiety sometimes. Often teens, because of where they are at developmentally, they worry that there's something wrong with them. They're somehow weird or broken. And I assure them that that's not true. I like to start out by really understanding what the anxiety is like for the teen that's coming in to see me. This can be really helpful and empowering for teens, because often a mistake people make with really good intentions, but still, is to try and talk a teenager out of it. To say, you're fine, don't worry, there's nothing to worry about. What are you getting so upset about? There's no problem here. And we do that because we care about a teenager and we just don't want them to be feeling anxious or nervous, but it's not necessarily the most helpful intervention. I find that teens really like it if I take the time to understand what the anxiety is like for them. So I'll tell them, let's talk about it. What is anxiety like for you? And I'm often looking for what does it feel like for them in their body. If you've watched any of my other videos, you know I love body drawing. So I'll sometimes map it out, or I'll have the client map it out on a body drawing. What does it feel like? What is your breath like? What does it feel like in your chest? What do you feel in your hands or your legs? And I take the time to really understand what anxiety is like for the teenager themselves. Friends, I want to make sure that you've taken a moment to subscribe to the channel. I try and put out new videos regularly, and I would love to notify you when the video comes out. So make sure to subscribe and hit the little bell notification so you know when a new video about mental health or personal growth comes out. Anxiety can be unique for each person, but there's also so many similarities that I see across almost all my clients who come in suffering from anxiety. Most people will say they have shallow or quick breaths. They can't get a good breath. Most people will say it feels like there's a weight in their chest. Or people will say some form of feeling like there's energy coursing through their body. They just want to clench their fist, or they want to kick something. So there's so many similarities that I see time and time again that helps me diagnose someone with anxiety. And I'm going to normalize the anxiety, tell them there's nothing wrong with them. I'm not going to try and talk them out of what it is that they're experiencing. And then I'm going to take the time to really be curious about their anxiety and what it's like for them in their body, in their thoughts. And that can be in and of itself a really powerful intervention. Okay, so once I've done those things, I really get into the heart of it, and that is education about why anxiety feels the way it does. why a person is going into what they might call a panic attack or an anxiety attack or just this overwhelming nervousness or anxious feeling. So this is the real heart of it. And it really helps to use some type of prop. So I'll often show a picture like this of the brain, and I talk to them about their amygdala. And I use the same technique with adults and kids and teenagers, but I just change my language a little bit with it. But I talk about what the amygdala does, and that essentially that part of your brain is a very useful, very necessary part of your brain that warns you if there's danger. So you want a healthy, strong amygdala that works really well, because if there is an emergency or a crisis, this is the part of the brain that alerts you and tells you, hey, get ready for fight or flight. So let's talk a little bit about fight or flight. So by the teenage years, most people have heard of fight or flight, and that's that very powerful part of our system that prepares us for danger, so that if a wild animal or something were to come out and jump at you, your body would prepare you to either stay in fight or flight, to run off and protect yourself. So it's a very useful, helpful part. But this is the key. I'll tell teenagers that it's really useful and helpful, but some people's amygdala is just a little more sensitive. It's perceiving danger when there's not a true danger there. But what is happening for them that makes them feel like there's something sitting on their chest, or they want to run, or something surging through their body, is that amygdala is perceiving danger, and it literally is coursing hormones and chemicals through your body to help you with your fight or your flight. So your body is flooded with oxygen and adrenaline to get you ready for a fight or flight. But most people don't actually need that system response triggered, because there isn't actually a true emergency occurring. So when that amygdala perceives danger, whether it's correct or not, it's going to flood your body with all sorts of chemicals and hormones, and that's why you feel the way you do. That's why you might feel a little dizzy or disoriented. That's why you feel like you want to punch something. You can't get a full breath. You have a surge of adrenaline moving through your body. Now be prepared, because this is often a really satisfying moment in counseling for the teenager, because they feel like someone really gets it. So they'll say, Quimby, yes, that's exactly it. That's exactly what's happening. I feel like there's an elephant on my chest, or I feel like I just need to shake and wiggle and move my arms like something is coursing through my body. Because it is. And so I think that they feel validated, understood, heard, and they feel a little bit of hope. Like, if this is a real thing that I'm experiencing, and it's called anxiety, and a lot of people are experiencing it, maybe there's not something wrong with me. Maybe there's something I can do to help myself. So then, yes, we get into what can you do to help yourself. Helping yourself is somewhat simple, but it is really effective. And so I really need to bring that home for teenagers, because the number one thing that you can do when you're experiencing anxiety like this is to breathe, is to take long, deep breaths. 3 breaths in, 3 breaths out, repeatedly. Why? Why is that going to help me with this crazy feeling? It sounds too simple. It's helpful because when you take long, slow, deep breaths, you're sending a message to your brain that things are okay. Because if you're taking long, slow, deep breaths, there must not be an emergency. There must not be a wild animal coming out of the woods ready to attack you, because you wouldn't be able to get those long, meditative breaths in. So the deep breaths have a real purpose. They're sending a message to your brain that things are okay, and the brain can turn off this fight or flight response and begin to calm down. And because it's so simple, I really do practice it with the clients. So I'll say, let's practice it now, so that when the anxiety or the nervous energy comes up in you, you'll know what to do. You'll remember. So we'll actually take a few breaths together, in and out, a few times. And then I'll ask them, well, how do you feel just even doing it now in the office with me? When you take a few breaths, how's that feel for you? Usually people will say it feels really good and calming. They feel a little bit more relaxed when they do the breaths. And that's exactly what we want them to feel. Another thing about this is that when you give them a tool like breathing and a tool like education on really understanding what it is, it's empowering. And we want to convince teens that they want to be in charge of their own brain, that it's within their power to control their own brain and pull themselves out of this anxiety response. Now, of course, another tool we can arm teens with is to identify the triggers for their anxiety. what are the times and situations, what are the thoughts that bring on this anxiety response? That way they can be prepared. So we're teaching them mindfulness. We're teaching them that, hey, every time I get on the basketball court, I have this rush of anxiety because I don't think I'm a very good player. I think other players are going to maybe be mean or make fun of me. I'm going to miss a shot and people are going to be mad at me. So there are all these thoughts that they're having that create an anxiety response for them. So they need to get really familiar with that. What are the things that trigger them? And it's usually a thought, and it's usually not a positive thought. It's usually a fear. It's usually fear thoughts that are starting this whole response, and we want to slow it down so that they can start to understand what the thoughts are that trigger their anxiety response. Now, this is pretty simple, and treating anxiety, I've had a lot of success with it in my practice. This stuff really works, but it's not a one and done. It takes practice. I'll have people practice everything in my office and then journal during the week and write down thoughts that they noticed that made them feel nervous, how they handled the situation, what successes they had doing the breathing, times that they just couldn't do the breathing and they went on and do a full sweaty anxiety attack. But it's going to take practice, so make sure you educate your teen about that this isn't like you do it once and it's done. We have to practice. You haven't done this before. We want to build a new pathway for you, a new groove, and it is going to take a little bit of time and practice, but you can totally do it. It's totally treatable. Of course, I like to get the family on board if I can, let anyone else in the family know what we're working on with the teen's permission, so that everybody can be surrounding this teen, supporting them, helping them, and know what it is that we're working on. So these are just a few simple strategies that I use to teach teens about their anxiety and teach them to manage and control it. This is not inclusive, of course. I could talk about this all day, but I want to keep the video somewhat short. I'd love to hear from you though. What's your experience with anxiety? What has helped you? If you're a clinician, what tools or tips would you like to add? We'd really appreciate hearing about it in the comments. And again, if you or someone you know is suffering from pretty serious anxiety, be sure to get help. It is treatable. Talk to your physician, talk to a counselor or therapist, and start the work on managing your anxiety so that you can just feel better. Thanks for watching, friends, and I'll see you in my next video. Probably, hopefully, another one of my teen videos. Check that out. Bye.